time around. Welcome, everyone. Please be seated. And let's hear it for our graduates. We can make some noise at this event. It is a celebration. Welcome to the Roseman University of Health Sciences College of Nursing, ABSN, June 2023-2024 pinning ceremony. I am Dr. Brian Oxhorn, Dean of the College of Nursing, and this is a great day for us. As educators, this day represents the outcome of the sharing of our knowledge, skills, and attitudes to our undergraduate nurses. As families and loved ones, this day represents the fulfillment of the dreams and aspirations of those closest to you. And for some of our graduates, this day represents socialization into a profession dedicated to the needs of others and improving the human experience. This is also a good day to remember your why. What is your why? What brought you here? What made you go through this past 16 to 17 months? These are the beliefs or the values that you hold that led you to our profession. Don't lose sight of your purpose for working so hard and sacrificing so much during your nursing school journey. Today, you are no longer student nurses, you are now graduate nurses. And for those of you who aren't nurses, that is a that we embrace. And over the next few months, one by one, you'll be calling yourself registered nurses. As you embark on your next chapter, return to your foundation of your why. Begin from that point as you develop and grow in your nursing career. Allow the how and what you do to be a reflection of what you value. I welcome you to our profession, and I am honored to have been a small part of your journey. Congratulations. Please welcome to the podium Dr. Renee Kaufman, President of Roseman University of Health Sciences.
Well, good evening, everyone, and nursing graduates. On behalf of the Roseman University Board of Trustees and its administration, let me be among the first to congratulate you. I heard somebody the other day talk about nurses being angels on earth, and I have no doubt that you will go forward in that proud tradition and be many people's angels as you serve in this trusted and needed profession. We thank you for choosing Roseman, and we look forward to the things that you're going to do in the future. Congratulations.
Congratulations to the class of 2024. We can do a whole lot better than that. Congratulations to the class of 2024. You made it. We are very proud of you. You have a solid foundation. You have Roseman Foundation. Why do I call it Roseman Foundation? Because it's so solid. You can build just whatever you want to build on it. If it's graduate program, no one is going to expect more of you than this program has requested, and you made it. You came through. So don't let this foundation crumble. Some of you will work for employers who will be willing to pay tuition for the next step. Take advantage of it. Not taking advantage of it is like leaving money on the table, a gift on the table, and walking away. Remember why you're here. You became a nursing student because you want to be a part of a noble profession. A profession that touches life from inception to the time of death. You are trusted. The patient will remember you. Don't forget, you are the bridge between the patient and the physician. And some of you have heard me say this before. You are the one who will tell the doctor, my patient is not doing so well. My patient still has fever. Don't take the responsibility for granted. You will do great things. You are now Roseman ambassadors. So wherever you go, we go with you. And wherever you go, do not forget friends, family, relatives, siblings who stuck with you, who stood behind you, who are still here today supporting you. We are proud of you. We have no doubt you are going to do an excellent job. So congratulations once more to the class of 2024.
All right, I am so pleased to be able to welcome and introduce the Roseman University of Health Sciences College of Nursing faculty and staff. This group of individuals have dedicated their time and effort to provide these students with the education they need to practice safely in whatever clinical area they choose. Up here on the stage is Dr. Andrea Leclerc. Dr. Veronica Castro. Professor Marika Kerr. Yeah, you can sit when you're done. Dr. Tamara Carley. Professor Stephanie Maston. Professor Mel Obasi. Professor Augusta Arato. Dr. Barbara Tanner. Professor Nancy Bryan. Professor Ellen Eversole, Professor Chantel Jackson, Dr. Amy Gear, and Dr. Fred Calixtro. And out here in the audience, we have Miss Anna Guevara, one of our administrative assistants who organizes all this. Miss Nicole Martin, another administrative assistant. Miss Nori Daza, administrative assistant. Ms. Donna Lafee, our clinical coordinator here in Henderson. Ms. Anya Reisert, one of our admissions specialists. And I know Ms. Christine Russell over here, another clinical coordinator, is hiding out in the corner. On camera right, we have Ms. Francia Garcia. And on camera left, Ms. Amy Ortega. And then all the way in the back there is Mr. Jason Gibson, who's our videographer and runs the AV units. So welcome. At this time, please welcome to the podium Professor Marika Kerr, who will read the tradition of the pinning ceremony and the lighting of the candle.
In the 1860s, Florence Nightingale devoted herself to caring for casualties of the Crimean War. In recognition of her service, she was awarded the Cross of St. George. Florence then extended the honor by presenting a Medal of Excellence to the most deserving student graduates at the Nightingale School of Nursing in London. Today, nursing schools around the world give a nursing pin to represent a Medal of Excellence to their student nurses upon graduation. The Roseman nursing pin is designed in the university colors of burgundy and silver. The shape of the pin symbolizes the unique block curriculum of the Roseman program. Each side of the pin represents the College of Nursing core values of service, integrity, innovation, and knowledge. The lamp of knowledge on the lower half of the pin signifies the nurse's science-based knowledge and commitment to lifelong learning, which are foundational principles of professional nursing practice. The lamp was a symbol of the care and devotion Florence Nightingale administered to the sick and the injured in the practice of her nursing. After nurses were pinned, Mrs. Nightingale would light a lamp and pass the flame to each nurse as they said the pledge. Today we carry on the ceremonial tradition, passing of the light.
All right, and please welcome to the podium your class speaker, Ms. Thania Carrillo.
Wow. Good evening, and thank you all for coming and supporting your favorite nurse for tonight. Tonight, October 15th of 2024, marks a significant milestone in our lives as we gather here to celebrate our graduation from Roseman University. First, I would like to extend my heartfelt gratitude to our family and friends who might have traveled far to make it to our special night, and to those watching us currently. Your unconditional love, support, and sacrifice have been the foundation to our nursing path. Thank you for the advice, the hand you offered, and the patience you gave us. Sorry. And the patience you gave us when in a state of panic and tears for the 90th percent rule. Thank you for never doubting us, even at times when we would question our own capabilities. Your encouragement kept us all progressing. And tonight we celebrate not just our achievement, but yours as well. To our instructors, mentors, and Roseman faculty, thank you for the wisdom you have shared and for instilling in us the moral principles that will guide our nursing careers. You have challenged us to think critically, have taught us the importance of leadership, the beauty of patient advocacy, but most importantly, you enabled us to express our needs throughout our learning experience with communication, with active communication, because you cared. From the bottom of our hearts, thank you so much. And to my fellow graduates, there's so much I'd like to say to you. We have faced many challenges that tested our determination. Time and time again, we were pushed to the limit. Some of us cried. Some of us lost sleep. Some of us had to limit our social time with family and friends. We all understood sacrifices had to be made. But it was not all gloom. It was not all gray. We also laughed. We made great memories. We volunteer. We established great lifelong friendships. From complex medical concepts to the emotional weight of patient care, each experience has been a testimony that nursing is not just a profession, but it's also a calling. It's about advocating for our patients, showing empathy in moments of vulnerability, and delivering care with dignity and respect. As we enter this new journey, let us not forget the accomplishment we felt when we inserted our very first IV, the gratitude our patients expressed, the frustration we felt when we couldn't do much for them, and the nurses we admired along the way. To conclude, let us carry forward the lessons we've learned and the bonds we've formed. Let us also embrace the challenges ahead with courage and confidence, to always prioritize our patients and strive to provide holistic care that addresses their physical, emotional, and spiritual well-being. Never be afraid to speak up for those who cannot speak for themselves. As we embark on this new chapter, remember we're not alone. We are part of a vibrant community of nurses dedicating to making a difference. Congratulations! Here's to the journey ahead of us. May we continue to learn, grow, and inspire each other as much as we can to continue to touch lives and make our mark in the world. Love you, and it was a pleasure.
Thank you. Thank you. That was wonderful. And now the presentation of the pins and the candles. Dr. Andrea LeClaire will read the student names. I will distribute pins, and Dr. Tamara Carley will light the candle.
Savannah Aguayo, being pinned by Oscar Chavez Mexicano. Christina Tamar Amirshian, being pinned by Violetta Malcolm. Christina Karen Banks Tamanaha, being pinned by Jacob Cassis. Geraldine Batalon, being pinned by LD Batalon and Jerry Batalon. Nancy Marie Balser, being pinned by Keith Balser. Duncan Burkwood, being pinned by Nora Nidick. Tania Carreo, being pinned by Blanca Para. Jasmine Chen, being pinned by Anthony Chen. Lorpu Cooper, being pinned by Daniel Tugabe. Kiana Cortez, being pinned by Marianne Cortez. Eddie Davis, being pinned by Ebony De Novelis. Cheryl De Vega, being pinned by Aurora Nicholas. Daphne Di Matulak, being pinned by Shirley Di Matulak. Jody Fassett, being pinned by Ian Fassett. Miori Freeman, being pinned by Anna Beltran. Corinna Garcia, being pinned by Salvador Garcia and Isela Garcia. Ruby Jimeno, being pinned by Carla and Caesar Jimeno. Claudia Gomez Revels, being pinned by Guadalupe and Maria Gomez Revels. Natalie Guzman, being pinned by Lorena Guzman. Chung Ho. Being pinned by Angela Wong. Hamina James. Being pinned by Anna Acevedo. Ashley Johnson, being pinned by Diane McNeil. Bianca Martinez, being pinned by Evelyn Martinez. Isabella Maypaw, being pinned by Jace Palmer. Michaela Odom, being pinned by Zachary and Rowena. Jasmine Ortega, being pinned by Daynira Ortega Munoz. Anne Fu Wong, being pinned by T. Fu Wong and Jason Liu. Carolyn Ramirez, being pinned by Karina Salazar and Valerie Ramirez. Gabriela Mendez Rendon, being pinned by Amparo Rendon. Stephanie Robertson, being pinned by Olivia Robertson and Vicki Richardson. Jocelyn Santoyo, being pinned by Veronica Soto. Stephen Scott, being pinned by David Scott. Jeffrey Shaw. Being pinned by Monica Shaw. Scott Dalton Spinner. Being pinned by Emily Brutout. Cynthia Tran, being pinned by Cindy Fan and Tree Tran. Monica Vasquez, being pinned by Teresa Bradley. Kyle V-Ray, being pinned by Catherine V-Ray. Sang Yim, being pinned by Sun Yim. Katrina Zacharias, being pinned by Jennifer Cruz.
Well, I would like to say congratulations. I'm not the first and I won't be the last. You guys are awesome. Okay, at this time, I would like to administer the oath. Graduates, you are here this evening to be recognized and congratulated. I would like to encourage all of you to continue lifelong learning, to stay current in your practice, and to always adhere to professional standards of nursing practice. Graduates, please stand and raise your right hand as we pledge the nursing oath together. I invite all nurses present to stand and join us as well. You will find the nursing oath written on the last page of your program. Taking the nursing oath is our pledge to always perform at the highest level and to provide the best care possible to patients, families, and communities we serve. Yes, we are going to do this all together. I hope all nurses are standing. Okay. In full knowledge of the obligations I am undertaking, I promise to practice professional nursing with all my skills and the understanding I possess, without regard to race, creed, color, politics, or social status of those entrusted to my care, sparing no effort to preserve quality of life, alleviate suffering, and to promote health as affirmed by the person. I will respect at all times the dignity and beliefs of the patients under my care, holding in confidence all personal information entrusted to me. and refraining from any action which may end life or health. I will endeavor to keep my professional knowledge and skills at the highest level and to give support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the profession. You may be seated.
Hello, everyone, and congratulations, students. Founded in 1952, the National Student Nurse Association is a nonprofit organization for students enrolled in nursing programs. It is dedicated to fostering the professional development of nursing students. The many activities participated in by these students develop continuous, lifelong learning and ethics of the profession. These students are known throughout the community for their hard work and compassion. I am very proud of the students who have demonstrated their integrity, compassion, humanity, and professionalism, and would like to recognize them today for their contributions to the community. Members, please stand as I call your name. Our President, Jocelyn Santoyo. Cheryl De Vega. Ruby Jimeno. Isabella Mapa. Anne Fuang. And Cynthia Tran. Congratulations, all you guys.
Apina Rasna, the Asian American Pacific Islander Nurses Association, Roseman University Student Nurses Association. It has a goal to unify Apina nurses in Nevada and beyond. This association's aim is to facilitate and promote networking, developing collaborative partnerships between nursing students, professional nurses, nurse researchers, nurse educators, advanced practice nurses, and community affiliates with the purpose of identifying the healthcare needs of AAPIs and optimizing resources to promote healthy living and improve lives. Apina Rasna members participate in collaborative partnerships in providing community outreach events such as vaccination clinics, food distribution, and feeding the homeless population in our communities. Through these activities, the goal is to encourage the continuation of the commitment of the students of Roseman to develop as our school's representatives to be vibrant and active members of the local community. Students, please stand and face the audience as your name is called. Kyle Jasper Hoven Viray, the outgoing president. Katrina Cruz Zacarias, vice president. Tania Carrillo Para. Cheryl De Vega. Daphne Nicole Di Matulac. Isabella Marie Meipa. Anne Fuang. Cynthia Tran. Congratulations. Thank you.
Congratulations, class of 2024. At this time, we would like to recognize the members of the Nursing Honor Society. Students are eligible for membership if they meet requirements on or before the designated due dates. Students will have demonstrated superior academic achievement, academic integrity, and professional leadership potential. The asterisk after a student's name in the program indicates that the student is a member of the Roseman Nursing Honor Society. Please stand as I call your name, face the audience, and remain standing until all students' names have been called. Katrina Zacharias, President. Cheryl De Vega, Public Relations Chair. Savannah Aguayo. Geraldine Batalon. Tania Carrillo. Lorpu Kupa. Daphne Dimatulak. Miore Freeman. Isabella Meipa. Anne Fuwang. Cynthia Tran. And Kyle Viray. Please join me in thanking the 2024 Nursing Honor Society members for the various services they have provided to the community, the nursing profession, and to Roseman University of Health Sciences. You may be seated.
Congratulations, students. It's so nice to see each of you here. MANSNA, Maternal and Neonatal Student Nursing Association. I'm Dr. Barbara Tanner. MANSNA was created by nursing students who want to prepare themselves for a career in women's health, obstetrics, and neonatal health. Our goal is to inspire and work collaboratively to improve maternal and neonatal health outcomes as future nurses. Each month, we provide education and activities that will help students gain knowledge that will then help them in their nursing careers. As I call your names, please stand to be recognized. Cheryl De Vega, President. Geraldine Batalon. Tania Carrillo Para. Lorpu Cooper. Daphne Demantuluk. Miori Freeman. Karina Garcia. Rubio Jimeno. Claudia Gomez Riveles. Isabella Mepa. Anne Fuang. Jocelyn Centeo. Cynthia Tran. Katrina Zacharias. Thank you for your services, students. You may be seated. CESNA, the Critical Care and Emergency Student Nurses Association, or CESNA, was established to help students interested in the critical care and emergency nursing fields that have a platform to learn more about each specialty. The organization focuses on educating students through presentations from specialists, promoting nurse apprenticeship opportunities, and doing volunteer work for the local community. During a disaster, the advanced triage system utilizes a color coding scheme. Red tags are used to label those who cannot survive without immediate treatment, but who do have a chance of survival. CESNA chose the color red to honor this system. Each CESNA member proudly wears a red cord to symbolize their devotion to the nursing profession. CESNA members, please rise as I call your name. Savannah Aguayo. Christina Amerchian. Geraldine Batalon. Nancy Balser. Duncan Burkwood. Cheryl De Vega. Miori Freeman, Ruby Jimeno, Bianca Martinez, Isabella Mepa, Anne Fuang, Jocelyn Santeo, Scott Spinner, Cynthia Tran, Monica Vasquez, Kyle Vare, Katrina Zacharias. You may be seated. Thank you very much for your services.
Okay. The Global Health Student Nurses Association, or GHSNA, strives to create and provide opportunities for all members to engage and serve locally, nationally, globally, and beyond the classroom setting. The Global Health Student Nurses Association serves as a link to all nursing students and professional nurses for local and global health experiences. This year, GHSNA has implemented many local community services and educational events. In recent years, Roseman nursing students and faculty have been involved with international mission trips to countries like Guatemala, Peru, Uganda, and the Philippines. Students, please stand up as I call your name and face the audience. Cheryl De Vega. Lorpu Cooper. Miori Freeman. Ruby Jimeno. Isabella Maypa. Jocelyn Santoyo. And Cynthia Tran. Please encourage our nursing students to get involved with local community service events and international mission trips to learn about global health nursing and how they can become patient advocates worldwide. Thank you, students. Please have a seat.
All right, so we'd like to just recognize our cohort class officers who provided leadership and advocacy on behalf of their peers. Class President Tania Carrillo, Vice President Stephen Scott, Secretary Isabella Mepa, and Treasurer Cheryl De Vega. We appreciate your willingness to provide leadership in the cohort and professionalism in the interactions with the College of Nursing. Thank you. You may be seated.
The Spirit of Nursing Award. This student embodies the essence of the Spirit of Nursing Award through their unwavering dedication, clinical excellence, and exemplary professionalism. Throughout their time in the nursing program, they have consistently demonstrated a genuine commitment to fostering a collaborative and supportive learning environment. Their willingness to assist others, whether by allowing their peers to practice vital signs, physical assessments, or by offering guidance within their scope, reflects their exceptional competence and empathy. This student has distinguished themselves not only through their clinical proficiency, but also through their ability to elevate those around them. They took the time to personally connect with students, offering words of encouragement, thoughtful feedback, and a helping hand whenever needed. This student is widely recognized within the nursing program for their altruistic nature, consistently going above and beyond to support their fellow students. In every aspect, this student has demonstrated a profound commitment to the values of nursing. We are confident that their contributions will continue to inspire and elevate the nursing community. The recipient for the Spirit of Nursing Award is Mr. Stephen Scott.
Oh, we got two? Okay, that's right.
Well, we also have another Spirit of Nursing Award. Throughout their time in the nursing program, they have consistently demonstrated a genuine commitment to fostering a collaborative and supportive learning environment. They have volunteered at several locations beyond the requirements for community service. They have held a leadership position for their cohort and are dedicated and compassionate about their chosen specialty to care for maternal newborn clients. In every aspect, this student has demonstrated a profound commitment to the values of nursing. The recipient for the Spirit of Nursing Award is Ms. Cheryl De Vega.
All right. See if we can get through this without you guys guessing. So the recipient of the Dean's Award is a member of various organizations inside and outside of the school. This student volunteered with the 3 Square Food Pantry, the ACDC Clinic, Baby's Bounty, and Catholic Charities. At the school, the student is a member of the American Association Pacific Islander Nursing Association, the Critical Care and Emergency Student Nurses Association, and the Maternal and Neonatal Student Nurses Association. During a recent clinical experience, a student was assigned to care for a client who had an ongoing medical condition and needed reassurance because of extreme separation anxiety. When the client's parents learned that their child had multiple ailments and they would be unable to provide care, they gave up and left the client behind. As a result, the client had frequent anxiety attacks and acted out. This student recognized these signs and symptoms from information learned in class and spent extra time with the client, providing thoughtful care and building rapport. For example, the student brought toys made for the blind to pique the client's interest and stimulate other senses. The student also spent time talking to the client about random topics to help distract the client and prevent anxiety. When the student learned that the client was comforted by a towel, the student made sure that the towel was always with the client. The student also worked with providers to modify their approach to pain management so that it followed the guidelines appropriate for the client's age. The smiles from the client during these interactions and the effects of the care the recipient gave were so powerful, they solidified the student's desire to be a nurse. By the end of the shift, the client's attitude had improved significantly, and the client was able to sleep through the night with less anxiety and without panic attacks. Ultimately, the student's confidence and understanding of comprehensive and holistic care made a significant difference. The clinical experience deepened the student's understanding of the importance of meeting a client's psychological and emotional needs in addition to treating physical symptoms. The student also experiences the power of devoting a little more time and attention to individuals in acute need of care. The student is a past leader of the Honor Society and has provided strong membership to members of the association. Please congratulate the winner of the Dean's Award, Ms. Katrina Zacharias. All All right. So, trailblazers. Yes, these guys are trailblazers. They're the first of a new curriculum that we had developed, and they were the first class to go through what is known as concept-based curriculum. So this is the concept of a pinning ceremony, in case you were just, so now you got that down too, right? So, well done. Well done, you guys. They take their last course. The assessment is kind of a licensing exam, mock exam. It's very similar to what we call the NCLEX, only I've heard it's very much harder than the NCLEX itself. That's not concept-based, by the way. And you guys did excellent. So whether you know it or not, you really learned something, because you took a test and like we prove it, right? So, you know, you're entering the world as a professional registered nurse, and you represent the future of our profession. So I challenge you to ask yourselves each and every day, how should I be, not what should I do? Think about your character, your values, your virtues, your ability to act outstandingly. Let your why shine through. Your journey of discovery does not end here, and continue to ask yourself in each new challenging situation, how should I be? I want to leave you with a new set of 5 rights, and that is, always act at the right time, regarding the right thing, towards the right person, with the right intention, and in the right way. Now you can be the role model for those you interact with and care for. And as you go forth and be fruitful, remember, watch your thoughts, they become words. Watch your words, they become actions. Watch your actions, they become habits. Watch your habits, they become character. And watch your character, for it becomes your destiny. And again, I congratulate all of you for such a well job going through the curriculum and being our trailblazers. So this does conclude our pinning ceremony. Students, could we please rise one more time and congratulate our loved ones? So thank you all for your support. It is really hard to get through any school, but I think nurses like to make it extra hard to get through, so we can't do it without you guys. So we're done with them. You can have them back now. But I am going to ask everybody just to remain seated just briefly as we do the procession. The students will follow behind the faculty, and then when it's all done, they'll come back in, and please join us for refreshments in the back. And you can cue the music.